The vaccine does not have the virus. It doesn't. I know there are a lot of persons who are concerned about getting that second dose. And I'm saying, to the extent that you have that card that says you are with me, don't worry about it, the vaccine is here. The other very important point to make is that it is important that those who must get their second dose actually take up and make the effort to get the second dose. Because there is a situation in other jurisdictions, and we hope not here, the persons have taken the first dose and believe that because they have the first dose, they are now protected, they don't need to take the second dose. Or they don't take the second dose because they may have had an adverse reaction, a fever and a headache, and they say, boy, I'm not going through that episode again. It is very important that we push and encourage and motivate. Dr. Gandhi spoke about vaccination week in the Americas this week and gave some very important statistics. I won't repeat them, but I think it's an important point to make because we have seen in the past week or two conversations around the effects or the likely negative impact of vaccines on those who receive vaccines. And I think it's important, as we have tried to do, and I believe Dr. Gandhi has reinforced that immunization, or for simplicity and better understanding, vaccination has been part and parcel of our history, our human development, public health in the Americas and indeed in the world. And back here in Jamaica, a very critical part of our human development index. In fact, our life expectancy has largely been impacted by our capacity using vaccines to eradicate diseases like polio and others. And this time it's no different in terms of COVID-19 and our response to COVID-19. We will have to depend on vaccines to play a very important role to manage this pandemic and to bring this virus under control so we can get back to normal life. I want to make the point too that the vaccine does not have the virus in it. And I think it's an important, sounds simple, but nevertheless important, because there's a view that somehow the vaccine gives you COVID and you are going to therefore have the risk of suffering and even having the ultimate demise. The vaccine does not have the virus. It doesn't. So there's no way that the vaccine is going to create the virus in you. What is important to know is that when you get the first dose of the vaccine, in this instance the COVID-19 vaccine, you need, I am told by the experts, between, let me just be sure so I don't, you need 21 to 28 days for the vaccine to take effect. So it is conceivable that you can get the vaccine today, and in a week's time, if you do not follow the protocol, you can pick up the virus somewhere because you may be under a false assumption that you got the vaccine yesterday, so you can go to the party or go to the, and you can mix and mingle, you can lose the mask and so on. It don't work like that. And I think maybe it's our challenge as communicators in public health. Maybe we're not doing as good a job as we should. We certainly have to review that and improve on it. It's going to take you 2 to 3 weeks to get the effect of it. In addition to that, and another very important point I want to raise today, is that having had the first dose of a 2-dose treatment, you will immediately, after the 3 or so weeks when the vaccine takes effect, you have about a 76%, I'm told, protection in the first month after the first dose, but then that decreases over 120-day period to as low as 30%, which means you still are at a risk, and that risk becomes greater over a 3-month period until you get the second dose, which then brings you back up and gives you additional protection. I raise that point to say having the vaccine, firstly, doesn't mean you won't get COVID. It is how your body responds to that. Within the window for the vaccine to take effect, the COVID will have the same impact as if you never took it until it kicks in, which is why you need to observe the protocol. You can only access through the appointment system, and we have about 50 odd locations across the country that will be open at some point during the course of the 1 week period. And when you make that appointment, we will tell you where to go based on where you are located. So there's about 27 to 28,000 vaccines available for regular appointments until we work towards getting another shipment while reserving the 40 for those who need the second dose. We do expect another shipment in May, and we are having conversations at different levels with different institutions. COVAX has committed a May shipment, and we hope that that May shipment will be more than the 55,200 that we've gotten this time around. And so we will give better particulars on that when the time comes.